Hello everyone, welcome to Radiance. I am Dr. Anmol Mishra. I am currently pursuing MD Radio Diagnosis in North Bengal Medical College and Hospital. In a few days' time, I'll be becoming JR3, and so I think at least I'm in a position to let you know what we do in our department. So, this video is basically going to focus on what is the role of a radiologist in the diagnosis and even in the management of a patient, first of all. So, what we do, what is our role in the hospital, that is one thing. Secondly, what is our job description? What is the exact work that we do in our department? That way, since the counseling period is going on right now, so you will get an idea about what we do here, because in our MBBS days we usually are not much exposed to radiology, so we do not know what happens in radio department. So if you get an idea, then I think it will be easier for you to decide whether to go for this branch or not. And secondly, if you have already joined, then in that case at least you can prepare yourself for what waits for you ahead. So let's fasten our seatbelts and get ready for the ride. So, welcome to the world of radio diagnosis. So, if you consider about the story of a patient, suppose a patient comes to you and he or she is being, first of all, gets a diagnosis, then that patient gets treatment, and then he goes home. So, in that case, if we consider this as a movie, then where does the radiologist stand in this movie? So, the radiologist is basically the director of your movie. Why? That is because if we don't give the correct diagnosis, then you know the treatment is going to fail. So our role comes in the fact that what diagnosis we give is going to direct the clinician, that what kind of treatment or which line of treatment he or she is going to go with. So if you give the correct diagnosis, that will help the clinician in employing the correct treatment option. Accurate localization of a particular lesion will help in a more targeted intervention. If you have a clear idea of the pathogenesis and the clinical presentation, only then can you give the correct diagnosis. Why? We as radiologists need to know about the imaging features, and along with that, we also need to give a provisional diagnosis based on it. So, for understanding why that particular imaging or feature is coming here, or why we get a particular imaging feature, for that you need to have an idea about the pathogenesis of the disease. That is one thing. And secondly, the clinical presentation is also going to help us, because there are certain diseases which have almost similar imaging wise presentation, but the clinical presentation often helps us to distinguish between different differential diagnosis. And yes, you need to be well versed with diseases of all subjects. Here I'm not saying that a specialist does not have any idea about the diseases of other subjects. A gynecologist, for example, is definitely going to have an idea, some idea about medicine as well. A medicine specialist is also going to have an idea about surgery as well. But the point is that they are not exactly in touch with it after their MBBS course. But in our case, we have to stay in touch with all the subjects of all diseases. So you might be looking at a molar pregnancy right now, and your exactly next case might be a shoulder dislocation. So you need to have an idea about both gynae as well as orthopedics. Not only these two subjects, you need to have an idea about a hell lot of subjects. So you need to be well versed. So a good radiologist is one who is well versed with both the pathogenesis and clinical presentation of the disease, as well as has an idea about all the diseases of all subjects. And yes, I don't know how to put it exactly in a humble way, but the point is that we medicos, unfortunately, most medicos are usually technologically challenged. There are definitely exceptions, but the fact is that we are not as good as engineers or other people of other fields. But in terms of being a medico, even if you are a medico, you might not be as tech savvy as an engineer, but for being a radiologist, you definitely need to be more tech savvy than your other branches, because we have to deal with DICOM images, we have to deal with packs, measurements, we can also, share cases. So for that, we need to have at least some idea about technology. Besides, our medical technologists who perform these imaging investigations like CT, MRI, we also need to have an idea about it. And for that, you need to be well versed with technology. So yes, we are medicos, but we can be really tech savvy. And yes, it's not like you're always behind the lens or behind the camera. You can also become the star of the movie, like the clinician, if you go for intervention radiology, where you can go for minimally invasive procedures which can save the patient from the risks of a major surgery, and at the same time give results as good as surgery. And yes, this is something that I really need to talk about. There are people who come to me and say that, I wanted to take radiology, but I was not sure about it because I thought that I won't be able to deal with only black and white all throughout my life. But it's not the case anymore. With the technological advancements that we have in our subject right now, we are full of colors now. You want proof? Okay, so have a look at this. This is the image of renal Doppler. So you can see the color Doppler images. So there are blue and yellow, red. There are a hell lot of colors. And then have a look at this. This is a 3D or 4D image of fetal face. And then this is what we call volume rendering on a CT scan machine, where you can get a 3D reconstruction of the structures that have been imaged by CT scan in axial, coronal, and sagittal reconstruction. So that way this can give you a 3D image as well. And see, look at the colors that you have here. So yes, we do have colors. Okay, so we definitely are the directors of our movie, but we also need cameras, and we have a lot of costly, expensive, huge cameras, really sophisticated cameras at our disposal before we say action. So here are our cameras. You have X-ray, you have USG, you have a CT scan machine, and you have an MRI machine as well. I don't think any camera is going to be as complicated as these machines. Okay, so clinicians really need us. Yes, I have to say this. The entire hospital is actually dependent on radiologists, because we, being a diagnostic branch, we are actually a common point for a lot of subjects. And they all need us in this day and age where imaging modalities and investigation based medicine has become so important right now. So clinicians definitely need us. You want to know why? Okay, let me give you a small idea. Okay, as for obstetrics, you want to localize pregnancy, or you want to find out the cause of bleeding in pregnancy, or maybe the gynecologist couldn't find fetal heart sound, or the patient had a trauma during pregnancy, or you want to ensure that the baby is absolutely fine, not malformed, and you want to rule out PIH or GDM related complications like IUGR and other things. Then don't worry, USG is your savior. For gynecology, if you have abnormal uterine bleeding, there is suspicion of PCOS, or you have dysmenorrhea, or there is infertility, postmenopausal bleeding, folliculometry you want to do, no problem. USG is there, and even MRI is at your service. Even medicine and pediatrics need us. You have chronic cough, your patient is suffering from hemoptysis, there is you want to evaluate for CLD or CKD, or you suspect stroke, meningitis, encephalitis, or demyelination, or there are symptoms of UTI and you want to find out complications. There is anemia, fever, or anasarca evolution, and you want to find out the reason behind it, or you want to characterize lymphadenopathy, or even small interventional procedures like a diagnostic or a therapeutic pleural or ascitic tap. And you can even go for renal biopsy, liver biopsy, even FNAC. These are the things we regularly do in our department. So you need X-ray, you need USG, CT, and MRI for all kinds of evaluation of these patients in medicine and pediatrics. Now, surgery, they heavily depend on us. So, acute abdomen, yes. If you want to stage a cancer, or you want to look for metastasis, or you want to localize a foreign body where exactly it is, we can even mark and send the patient there. And at times we have also had to go to the operation theater and directly show where the particular foreign body is. And you want to characterize swellings, or assess organ injury in trauma patients. This is a really useful thing that we do. We go for E-FAST, and that is really a quick procedure to screen for injuries. And you want to localize, quantify, drain, or monitor an abscess. Or if you want a biopsy or an FNAC sample, then definitely we can help. So for these, you might need either an X-ray, USG, CT, or MRI, depending on which of these things you want to know. For orthopedics, yes, they again need us. You want to identify, classify fractures. You want to monitor whether fracture healing is happening properly or not. There is chronic low back pain or stiffness, which is in today's day and age really common. And you want to characterize bone tumors, detect osteomyelitis and its complications. You need biopsy or FNC sample, just like in case of surgery. Then also we are ready with X-ray, CT, and MRI for you. And if even in subjects like ENT and ophthalmology, they need us. How? In ENT, if you want to localize an aspirator or ingested foreign body, this is an investigation which has to be done on an emergency basis. And if you want to identify a certain extent of ear infections, if you have complaint of nasal blockage or epistaxis, you can get a CT-PNS done. For characterization of cervical lymphadenopathy, USG is there for you. And you can even stage head and neck cancers with MRI. And if you want biopsy or FNAC sample, then also we can help you with USG or CT guided biopsy or FNAC. So you just ask for it, and we are ready with X-ray, CT, MRI. Sometimes, as I said, you need USG as well. For ophthalmology, you want to assess posterior segment, and for example, the patient has a mature cataract, because of which your IO or your DO, whatever ophthalmoscopy you are using, it cannot penetrate the opacified lens. So in that case, you can use USG B scan. And if you want to identify a certain extent of intraorbital masses, then MRI is there for you. So USG B scan and MRI can actually do what ophthalmoscope cannot. And anesthesia, even they need us. How? Pre-anesthetic checkup, our surgeons and our gynecologists are totally dependent on them, and they need at least a chest X-ray before they can send the patient for or they can stamp the patient as fit for surgery. So actually there's a lot more that we do, but to find out, you'll have to wait till you join us for MD. So see you on the other side. But there's a small footnote here, and that is they depend on us, but for growing, for becoming a better radiologist, you also need them. You need them to follow up your cases, so that, because you can give a provisional diagnosis based on your imaging, but they will tell you by surgery, by histopathology, that what the exact diagnosis was. So you are also going to learn from them. So never underestimate them as well. They also help you a lot.
So that is it for today's video. If you found this video useful, then do not forget to subscribe to our channel, and also share this video with people who will need it, or you think that they should watch it. And if you want to know anything else, you can write down in the comment section below. And do not forget to hit the bell icon so that you get notified about all the videos that we'll be posting further in this channel. And there is another thing that I would like to say, and that is this video is only about the role of a radiologist. I am not exactly telling you about the job prospects here, or why you should exactly choose this branch in terms of monetary benefits, or in terms of your work-life balance. These things I can discuss later on. If you want a video about it, then do let me know in the comment section below. I will definitely make a video about it. As of now, this video was about what a radiologist does. So with this, we come to the end of the video. Thank you for your patient hearing.